Your eye sits inside a custom-built, shock-absorbent living room made of bone. This space exists to protect a fragile artifact floating in the center. This anatomical room, which doctors call the orbit, has the same basic components as any other house. It has a solid roof, a floor, and side walls, all constructed out of bone to keep the occupant safe. When a blunt object like a baseball strikes the face, it releases massive kinetic energy. As this energy spreads, the delicate eyeball stays still. The bony walls take the hit, buckling and cracking in thinner spots to absorb the force before it reaches the eye. Because the damage follows these structural lines, doctors categorize orbital fractures by mapping out exactly which parts of this room gave way. A simple fracture occurs when only one wall of this protective room crumbles under the pressure of an impact. In this blowout fracture, the floor of the room gives way and swings downward into the sinus cavity below. The room now has more volume, so gravity and pressure cause the eyeball to sink backward into this lower space, a shift doctors call an ophthalmos. Contrast that with a blow-in fracture. Instead of swinging out, a wall or the ceiling buckles directly into the center of the room. With the ceiling taking up space inside, the shrinking room forces the eye to bulge awkwardly out of the socket. Whether the eye sinks or bulges depends entirely on the new dimensions of the room. The bone shifts, and the eye follows. Children's bones are anatomically unique. Because they haven't fully hardened, they act like flexible green twigs. They bend and snap rather than shattering into pieces. This flexibility creates the trapdoor fracture. The floor of the room bows open for a split second, allowing the muscles that move the eye to slip into the gap. Then the bone instantly springs back shut, pinching the tissue like a pair of pliers. On the outside, everything looks fine. Because the bone snapped back into place, there is often no visible bruising, and the eye remains perfectly white. However, that trapped muscle is now physically pinned. The child won't be able to look up, and the pressure on the nerves can cause intense nausea and a dangerously slow heart rate. Surgeons have a very short window to release that trapped tissue before it becomes permanently damaged. A white, calm-looking eye can hide a structural emergency. To understand more severe trauma, we have to look at the foundation of the entire face. A complex fracture is a failure of the load-bearing pillars that hold the face together, usually involving two or more walls of the orbit. The cheekbone is the primary pillar of this structure. When it's hit with enough force, it typically breaks at 4 specific points at once, leaving the entire side of the face without its structural anchor. Surgeons rebuild this foundation using the hardware shown here. They use titanium plates and meshes, carefully curved to match the original anatomy, to lock the pillars back into place and restore the face's geometry. Simple fractures are about patching a wall to move the eye back into place, but complex fractures require a complete reconstruction of the skull's foundation. From dropped floors and caved-in ceilings to pinched muscles and shattered pillars, these injuries map out the different ways our protective architecture can fail. But these breaks aren't just accidents. They are part of a highly effective defense mechanism, a built-in crumple zone for the head. The impact pushes the eye back, forcing the soft tissue and fluid to surge outward like a piston. Those paper-thin bones are designed to snap under that sudden pressure, acting like a safety valve for the eye. Modern oculoplastic surgeons act as the master architects of these spaces. They can slip behind the eyelid to reach these broken rooms, propping up the floor and clearing away trapped tissue without leaving any visible evidence of the repair. The bone shattered so the eye wouldn't have to. It's a defense mechanism that worked exactly as intended, leaving behind a structural puzzle that we now know how to solve.